pass this over to Karen Minyard to begin for us, if you would be so kind, Karen.
Hello, everybody. I'm glad to be able to be here with you today, and I'm looking forward to our conversation and what I'm going to learn from being with you. I was thinking that it was time for a little bit of inspiration, and so I have two things of inspiration for you today. One, a quote from Albert Einstein, and the other is a poem, a short poem. So the quote from Albert Einstein is, "Out of clutter, find simplicity. From disorder, find harmony. In the middle of difficulty lies opportunity." He didn't know about what we were going through when he wrote that, but it seems timely. And then I'm going to share with you a poem. When this
lady's just talking about quotes and poems right now. So
Hello.
When this is over, may we never again take for granted a handshake with a stranger, full shelves at the store, conversations with neighbors, a crowded theater, Friday night out, a routine checkup, the school rush each morning, coffee with a friend, the stadium roaring, each deep breath, a boring Tuesday, life itself. When this ends, may we find that we have become more like the people we wanted to be, more like the people we were called to be, we hope to be, and may we stay that way, better for each other because of the worst. So welcome, and I'm looking forward to our conversation today.
Thank you, Karen. They were both beautiful.
yeah.
I want to remind everyone that the webinar is being recorded. And I'd just like to quickly review the agenda. Karen just did the beautiful introduction. Brenda Lee will give us an update on certifications that have recently happened. We've invited hubs who were recently certified who have a few moments to spare to share some information about their hubs. They'll be doing that. Bill Rensher will be giving us updates on some Georgia Health Policy Center updates related to COVID-19. Sarah and Mark will give us updates about PCHI. Rick will speak about research. Brenda and I will talk about new types of certifications. We'll talk about upcoming webinars. If we have time, we'll talk a little bit about a housing pathway challenge that a hub has mentioned, and Mark will close for us. So we have a jam-packed agenda. So I will say, let's begin. Brenda, I'll pass it to you.
Thank you, Amy. And thank you, Karen, for such wonderful, inspirational words. They were definitely most useful. I want to express my pleasure about joining everyone today. And I'm not sure if you know feedback from my... Is this better? It seems like I was getting a lot of feedback. I want to congratulate 7 hubs that went through this the spring cycle this year. Unfortunately, COVID got us off schedule a little bit. We normally have 2 certifications a year, one in May and one in November. This year, because of COVID, we had it in July. But special recognition goes to 4 new hubs: Bridges to Wellness in Ohio, Stark County Community Action Agency in Ohio, Stark Thrive Pathways Hub in Ohio, Unite Wisconsin, formerly Unite Milwaukee in Wisconsin. Congratulations to those new hubs in their accomplishing their certification. Then we have 3 hubs that went through the recertification process: Community Health Access Project in Ohio, Health Project Hub in Michigan and Northwest Ohio Pathways Hub in Ohio. So if we could just give them a round of applause for their accomplishment, that would be great. And now I will turn it over to, so you heard me mention that there are typically 2 cycles per year, one in the spring and one in the fall. Key dates that are coming up for the fall certification, the application should have been submitted in August. We will be undergoing the compliance review August through October, and we will convene the evaluation review panel
Excuse me,
in
there's a lot
November.
of feedback. There's like an
For the
echo.
spring 2021, the application process begins in January, and compliance review will go from January through April, and we will convene the evaluation review panel in May of 2021. Subsequently, the fall 2021 applications are due in August of 2021. The compliance review process will be ongoing from August to October, and we will convene the evaluation review panel for certification determination in November. I'm happy to have individual calls with hubs that are embarking on the certification review process. And all you have to do is just email me and let me know if you'd like to have a conversation about the process. Thanks, Amy. So we are going to be embarking on a new certification program, the Pathways Agency pilot, and we plan to launch the pilot in January. We will have a limited number of participants during this process. We're thinking about up to 4. The applications will be due in January, and the duration of the pilot is for 2 years, from January 2021 through May of 2023. There will be 2 designation levels, level 1 and a level 2. And as you can see on the screen, there are lots of benefits similar to the hub certification. Because we embrace evidence-based approaches, we engage communities and community-based stakeholders, we address individually modifiable risks, we maintain accountability and establish value-based payments. Those are very attractive features of the pilot program, and they're attractive not only to the agencies, but to the payers and also to communities who are committed to trying to make sure that there's health equity. Questions about the pilot, feel free to give me a call or send me an email, and I'd be happy to discuss those issues with you.
Thank you, Brenda.
Mm-hmm.
What I'd like to do now is invite each of the hubs that have either been newly certified or recertified. We've worked together with each of them, so they each have a few slides. Anyone who's had time, and recognize this is a very hectic time of year. So if you're one of the hubs that didn't get to respond and you don't have a slide here, but you're on the call and want to speak, when the others have gone, please let me know. We'd love to hear your voice. But we'll start with the new hubs first, and then go to the recertified hubs. Before jumping in, I just want to show you the map. There's a lot more green on the map of where hubs are in the States than there was a month ago. So a lot of hubs that were underway have moved to being certified, and that's just a nice expansion of real estate, and well done. So the first new certification that will share information with us is Bridges to Wellness, and Sarah McFadden-Enlick will walk us through what her hub is doing. It's all yours, Sarah.
So I drew the short end of the stick. I'm going to go first. And I even said, Amy, don't make me go first. So
Sarah,
service area.
Sarah, we're unable to hear you. It sounds like you're quite far from your speaker.
Like right next, is that better?
Maybe marginally, but go ahead.
Well, I really don't even have to talk very much. I'll yell it really quick. I have the short end of the stick to go first, so I'm not sure what all we're going to talk about. Everybody can see what my service area is. We went through certification with this big 8-county service area, which is basically southeast Ohio, a lot of areas in southeast Ohio who will not have the infrastructure to maintain a hub, so they all kind of wanted to come in with us. We do serve all populations, so all of our pregnant moms, but then we also serve any adults who have chronic issues or are at risk. In my opinion, it works, no matter if it's an adult that has diabetes and is homeless and does not connected to a medical home, the model still works for them. So we're just operating anybody at risk in our area we're serving. And we also enroll the babies that are born to our OCMH moms and watch them for a year, make sure they're all connected. So currently we have 9 CHWs in place, and of 6 CCAs and about 3 more that are ready to jump in the next month after they get a little bit more training. We also have 4 new CHWs that are going to go through the PCHI CHW training, so that's exciting to get that, and that's about it.
Sarah, thanks so much. I appreciate it. Was there a question? All right, we're going to then move on to a new provisional certification at Stark Community Action Agency in Ohio. We have 2 members of the team who will be sharing with us today, Mary Martell, the Hub Director, and Chanel Harvey, the Clinical Coordinator. And it's over to you, ladies.
Good afternoon, everyone. I'm Mary Martell. I'm the Hub Director at the Stark County Community Action Agency Pathways Hub in Stark County. Where, like Amy said, and Brenda, I want to extend a thank you for your congratulations, as we did just move through the certification process successfully. So I'm gonna kind of bow behind the scenes now and let my clinical coordinator, Chanel Harvey, give you a little bit of insight about our hub and our operations.
Hello, I am Chanel Harvey, as Mary already stated. So we are the Stark County Hub. We are the Community Action Pathways Hub, also known as the CAP Hub. We are funded by the Ohio Commission on Minority Health, and we currently just have the two staff at our hub, me and Mary, and we have 4 CCAs, 4 CHWs, and we have a focus on infant mortality and chronic disease. We're small, but definitely mighty. So our journey to provisional certification is outlined on your screens. We did apply for full certification. However, there are 2 hubs currently operating in Stark County. So an agreement was made for both of us to seek provisional certification while all of our kinks were worked out. Big applause to Mary for completing the certification process. I went out on maternity leave at the end of May, so she was on her own until I returned in August. So we applied for provisional certification in November of 2019. We completed our prerequisites during the winter months, and then Mary finished out the standards over the summer and presented to the certification board in July, and we were awarded certification in July of this year. If I was to give any tips to anybody seeking to embark on the journey to certification, I would say definitely focus on documentation. I tell our CHWs and supervisors all the time that documentation is key. If it isn't documented, then it did not happen. Their documentation in CCS, it helps make sure that you have the proper documentation and proof of the work that's being done. I could probably be considered OCD, but being a record keeper definitely proved to be beneficial for us as we gathered the necessary documentation for the prerequisites and standards. It's also important to know your way around CCS, especially on the reporting side. Well, CCS for those that do use CCS. I have a lot of different reports that I've customized, and I can easily edit them to pull information that's needed for various reports, and I'm constantly creating new reports as well. Last, but probably the most important, I would say, remember the mission and remember the why. Don't be so far removed that you can't get your hands dirty. Speaking for myself, I've assisted with home visits, helping connect our clients to services. It's important to be touchable. With the pandemic, not literally, but definitely make sure that you're reachable and relatable. I believe that my relationship with our CHWs and my contact with clients has definitely made a huge impact on how we've been able to impact the infant mortality in Stark County, even though we're a smaller operation. None of us are any better than our clients or CHWs, so just remember that you're not invincible, and we could easily be in some of their shoes. That's all.
That was wonderful. Thank you. And congratulations on the baby. That was some pretty impressive timing for that beautiful child. So
Thank you.
thank you. I'll now go to our second new provisional certification for Stark County Thrive in Ohio. Two members of that team here, Dawn Miller was the Thrive project manager, and Sandy Marinchik is the hub manager. And I will turn it to you, ladies.
Mute buttons. Thank you very much for the introduction. I'm Dawn Miller. I oversee the countywide collaborative known as Thrive, which stands for Toward Health Resiliency for Infant Vitality and Equity. Our service area for our hub is all of Stark County. Under the Thrive umbrella, we have several initiatives that we have put into practice since 2016. Probably the largest is our Pathways Community Hub. We currently have 22 community health workers employed by 11 care coordinating agencies. And to date, we have enrolled and provided services to approximately 1,200 individuals. We also support and manage 2 centering pregnancy programs, one in Alliance, one in Canton, both at, excuse me, federally qualified health centers. We have a focus on social determinants of health and have formed 2 teams, one that focuses on housing for pregnant women, as well as families with a child under age 1. That particular team is led by myself. We have representation from a cross-sector of community agencies and individual residents. Also, a social determinants of health team is led by our epidemiologist, Jessica Boley, and focuses on adolescent health and family planning. We have fatherhood initiatives, including the Fatherhood Coalition. We have engaged with the Early Childhood Resource Center to provide Dr. Dad, 24/7 dad and parent cafes. We also partner with DJFS and Community Legal Aid to implement legal parenting time orders so that family members who are non-custodial parents are able to spend time with their children. We also have several faith-based and grassroots initiatives throughout the county. One that we're very proud of right now is the Mary Church Terrell Federated Club, and they have received training and are facilitating sister circles, which provides support to primarily African American pregnant women and those with an infant. We also have contracted with Kent State University to perform a comprehensive evaluation. Can you go back?
Sorry about that.
That's okay. And excuse me, of the Pathways Hub and our community health workers services. Also, engaged with Stark Mental Health and Addiction Recovery and their cultural competency and humility. They provide population-based trainings to address the equity or inequities that occur in delivery of services. Okay, now you can go on. This is what we call our org chart. It is a visual representation of just what Stark County Thrive, including the Pathways Hub, is. We have received funding through the City of Canton Department of Community and Economic Development. We have Health Path Foundation dollars, Ohio Department of Health dollars, Ohio Department of Medicaid is probably our largest funder for the hub. But we also have support through the Sisters of Charity Foundation of Canton, Stark Community Foundation, and United Way of Greater Stark County. As you can see, we have a large number of community partners and referring agencies. The Stark County Fatherhood programs are listed there. We are led by a small team of, well, soon to be 6 people, including a neighborhood navigator and an epidemiologist, as well as our executive assistant, Danielle Grimm. The Pathways Hub, and I'll let Sandy jump in here a little bit more. We have just recently added our hub coordinator, Marcy Esper. We also have, as you can see on the far right of the screen, the Evaluation and Quality Improvement Committee, again, representatives from the various agencies, CCAs, providers, and community residents are also on that. And then below, along the bottom, is a list of our 11 care coordinating agencies. We do provide services to pregnant women with a focus on African American women. We serve adults with chronic disease. Pediatrics is a new area in which we are beginning to get referrals. And we are able to provide any services for a parent guardian with a child under age 1. But we're pretty much throughout Stark County in the provision of services. Next.
Great, Dawn, you've got about 30 seconds more. Thank you.
Okay, all right. So this is one of the key areas of focus that we're doing with the Kent State University is doing a propensity score matching, where we are putting together a counterfactual, if you will, of Stark County mothers who have given birth, comparing their birth outcomes indicators to the actual Thrive participants. What we have seen preliminarily is that our outcomes are statistically significantly better than the county as a whole. Sandy, do you want to just take a real quick minute or seconds to share any information?
No, you pretty much covered it all. I think you covered it all.
Okay.
No need.
Thank you both for the prep and for sharing all the work you're doing. Much appreciated. We're going to now jump into some of our recertified hubs. Northwest Ohio Pathways Hub in Ohio. Key hub staff is our Jan Ruma, the hub director, and Carly Solomon, the assistant director. And Carly's going to give us an update on the work of the hub.
So thank you so much, Amy, and I will be brief. So our hub has been in existence since 2007, and we were certified in the very first round in 2014. So we currently have community health workers in 3 counties in Ohio, but we have a 6-county service area. Sorry, my kids have been completely silent until you called on me, and now.
Oh, please don't worry. It's nice to hear their sounds. Don't worry.
So we are a fairly large hub. We serve pregnant women. We serve women of childbearing age. We serve adults with chronic diseases. I will, but I need you to give Mommy a second. I know. We partner with the University of Toledo Human Trafficking and Social Justice Institute to pilot the Pathways Hub model with victims of human trafficking. And we also serve breast health patients. So we have 32 community health workers currently across 14 care coordinating agencies. And to date, we've served over 8,000 clients in our hub. Probably about 75% of them being pregnant, just because we didn't add in our chronic disease population until 2014. Our largest focus area is still pregnant at this time. Our funding sources, we have about 15 different funding sources, from grants to Medicaid managed care plans. We contract with all 5 plans in the state of Ohio. We have TANF funding. We have funding from the Department of Health and Human Services, as well as through the HRSA funding, and then a couple of smaller community grants as well. So.
And all the while managing kids at home, like many of our hub managers and our CHWs. Thank you so much, and please tell your kids thanks for holding it together. They did a good job.
Thanks, Amy.
Our next is the Health Project Hub in Michigan, who was recently recertified. Judy Kell is going to share a couple slides with us and give us a quick overview of her organization and hub. Judy, if you're
I'm trying.
There you go.
Now, can you hear me okay?
Perfectly, yes, thank you.
All right. So instead now I've kind of goofed up the screen. So I'll tell you a little bit about our hub. We serve several counties along the lakeshore of West Michigan, and we recently added Kent County, which includes Grand Rapids, Michigan, which is the second largest city in Michigan, and are very excited about that opportunity. We've been in operation since 2013 and have served about 11,000 plus patients. We have 28 health workers through 7 care coordination agencies. In addition, we have, and as you can see on the slide, I'm not going to read this to you, but our populations include high-risk pregnancy. We have health workers placed at 2 of our very high-risk school districts, so we have Healthy Futures. We serve the chronic disease population. We also were fortunate to get a senior millage allocation, which pays for 1 health worker based on outcomes and for services to seniors. And then we also station a health worker out in all the municipalities so that we can meet the patients where they are. They may sometimes not need many things to be done for them. They just may need a one and done pathway, such as an insurance. But this is something that allows those seniors some additional opportunities to link with us. On the next slide, you'll see as we continue our programs, we also partner with the Prescribe for Health program. It's a partnership with an urban farm, one of our federally qualified health centers, and the MSU Extension. The health worker links the clients to the social determinants and the medical care, and make sure that they attend their healthy cooking classes. And a prescription is actually provided for this service by a physician at the federally qualified health center. One of the things that our health workers saw very soon was that we have a very high incidence rate of diabetes in our community. And they came to me and said, listen, we really would like to work with patients before they become amputees or before they have to go to dialysis. Is there anything that you can do to help us? So we applied and received a 5-year CDC grant for a diabetes prevention program. And while that isn't linked necessarily with the health worker, it came out of the health worker's ideas as a result of serving those high-risk diabetic patients. Again, we started in Kent County. This was, we were also initially certified in 2014, and this is our recertification, but Kent County has allowed us to really expand into helping high-risk African American and Latinx women with pregnant services, and then through 18 months of their child's life. And we have now just started reaching out to the East African refugee population in Kent County. So we're very excited about that opportunity as well. I'm trying to think of, what's the next slide? So new programs coming soon. Actually, today was our start of it. We took over the Women and Infant Children Nutrition Program located at one of the federally qualified health centers. And we're also taking over as of today a maternal infant and health program at the Clinica Santa Maria. So we've really been able to expand our services. So one of the things that's not on the slide that I'll talk about quickly that Amy asked me to talk about, and that is the fact that we are also staffing one of our temporary residences for COVID homeless patients. Our health workers link those patients to all of the social determinants of health. My nursing staff goes out, helps them with their medications and those kinds of things. It's the temporary residence population is winding down right now, but we expect that it will wind back up in the fall with the flu season. How are we funded? We do get community benefit dollars, not only from Mercy Health Muskegon, but from St. Mary's in Grand Rapids. We have the senior millage from Muskegon County. We have a Kent County millage. We are paid by the Strong Beginnings programs. We have contracts with insurance companies. We also are paid by the Center for Disease Control for our diabetes prevention program. And finally, our new grant is to actually pay for a health worker who's going to really do a very innovative thing, and was funded by the Michigan State Housing Development Authority, because as many places do, we have a by name list case management program through our homeless continuum of care for veterans and for chronically homeless. And these programs are funded by the Department of Housing and Urban Development or the state of Michigan. What this health worker is going to do is she is going to coordinate through this by name list process all of the housing dollars, whether they're local philanthropy, FEMA dollars, CAP agency dollars, and really develop that by name list process so that person is coordinated no matter where they are in the community and what agency they belong to, so that there is less duplication of services. And we were asked to do that by the Michigan State Housing Development Authority as a pilot. And if they like what we do, they may well replicate that throughout the state of Michigan as a way to best meet the needs of folks with housing needs in their communities. So that's our,
Oh, sorry, go ahead.
and that is us.
Thank you so much. I'm gonna zip through this one and run to our next one. We're running a little bit behind. Thank you so much for taking the time. And Brenda, I'm gonna pass this back to you.
Hi. So everyone who has gone through the certification process now has received the new seals, and we're particularly delighted with the new branding and hope that you feel the same. Amy, want to take me through the next level? So I guess I shouldn't have gone so quickly, but
No, you're great.
I
You're
have a
great.
steel breach designation for level 1, 2, and provisional, and would love to hear your feedback about our new branding.
And we do encourage the hubs to get
Thanks,
this
Amy.
on their websites as well, as an indication of the quality of the work you're doing.
Amy?
Yes. Thank you. We're going to now transition into Georgia Health Policy Center update from Bill.
Hi, everybody. Amy, you can go to the next slide. Just a quick update about what we've been doing since our last webinar. As of course you know, COVID continues, and we have been very busy with several groups at our center looking at different aspects of COVID. We have a group that's looking at the COVID legislation. We call this our COVID legislation learning group. We read and analyzed the 3 main COVID-related bills that came out of Congress this year, and also the CARES Supplemental Act that came out about a month after the other bills. And from that work, we have put together, or we are in the process now of putting together an infographic on how the COVID legislation has impacted rural health and provisions in the legislation that impact rural health. We're also working on a summary brief of the legislation and some other smaller briefs and infographics as well. We have another group that's focusing on equity around COVID, and we published a brief recently, just a few weeks ago, on COVID-19 and racial disparities. And as I'm sure, not a surprise, I'm sure you know that the COVID pandemic has really affected communities of color in much greater percentages and rates than it has white communities. And then right now we're working on a brief looking at rural and urban disparities with COVID, and that should be coming out in the next few weeks. We also have other groups at the center looking at COVID's impact on Medicaid, telehealth, and perhaps what might be most helpful for some of the hubs are our work that we've done around adaptive strategies and cross-sector alignment. The cross-sector alignment has come about because of our work with the Robert Wood Johnson Foundation on aligning social services, public health, and healthcare. And finally, you can see all of these on our webpage. We have a COVID resource page. The link is here. It's ghpc.gsu.edu/GHPC-COVID. So encourage you to check those out. We have a lot of good stuff. And that's all I've got.
Thanks so much, Bill. Now we're going to hand it over to Rick Wilk to talk about research and just give a general update.
Great, thank you, Amy. Well, hello, everyone. I hope you all are doing well, and it's really good to see so many of you. There continue to be opportunities to build new, expand existing, and undertake research at Pathways Community Hubs through grants and partnerships. Can you please let me know if you're interested in learning about these opportunities if you have not done so already? You can communicate your interest and contact information if I don't have it in the chat box or offline. And at the very beginning of the chat string, I put my email address in at the beginning of the meeting. So if you don't have my contact information. But I'm not talking long today. I'm really excited because Dr. John Hornbeek has agreed to talk with us today about research. And I'm excited to have John speaking today as he is one of the leading researchers on the Pathways Community Hub model. John is the director of the Center for Public Policy and Health, College of Public Health, Kent State University, and also professor, Health Policy and Management, College of Public Health, Kent State University. So John, I'll turn this over to you.
Thank you very much, Rick. Appreciate the opportunity to visit with folks here. It's very interesting to take in the updates from the hubs that have undergone recent certification. I'm learning things from that process. Thank you for those briefings. I'll just briefly share a little bit about the work we have done and some of the interest we may have in relation to all of your work and our willingness to try to be of assistance to any or all of you should you think it appropriate. Over the last several years, with significant support from Akron Children's Hospital and Dr. Redding, we've undertaken a number of research projects that have to do with the Pathways Community Hub model and more broadly with the concept of risk as a way to organize public health services. That's resulted in several peer-reviewed journal articles, one led by Dr. Redding that kind of laid out an overall research strategy in the Journal of Population Health. We had the good fortune to work with the folks in the Northwest Ohio Hub around an evaluative project on their chronic disease program, and Dr. Edward Chiaka published a piece in the Ohio Journal of Public Health based on the results of that evaluation project. And more recently, just several months ago, there was a piece that we developed in relation to work by the Pathways Community Hub Institute and our Center for Public Policy and Health surrounding risks to the 0 to 1 age population in particular, which we understand has been used in some of the certification work down at PCHI. We've also had a doctoral student write his dissertation on the Pathways Community Hub, which drew on a methodology that is quite similar to what Dawn mentioned earlier today in relation to her work at the Stark Hub as well. Currently, we have projects underway with the Georgia Health Policy Center around cross-sector alignment and have several case studies under development as a result of that work. A follow-up project looking at the explanations for pathways completion that exists for those with chronic disease, and are finding, oddly enough, in this age of COVID, that personal contact makes a difference. At least that's what those study results are suggesting at this point. We are working now with Mansfield Hub, the CHAP, as well as PCHI, to move forward in a process of integrating data across hubs to allow for analyses that would extend beyond any single hub, so that we could start speaking more generally about concepts of risk based on those data and their effects, as well as perhaps effects associated with the model's use as a whole. We also have a group of researchers from multiple institutions around the country that are looking at a research strategy moving forward, and so we've got our plate filled now, and are reaching out to you all as well. If you feel we can be of help to you, please do contact us. We are interested in learning what you're doing, as we're learning today through this call, and if we can be of help, please let us know. Thank you.
John, thanks so much. We're now going to transition over to Mark and Sarah to give updates on general updates to the PCHI model.
Thank you, Amy. I think Karen's introduction kind of summed up our whole update to the model from out of clutter, find simplicity. And that's really been our mantra over the last year and a half. And I know we've talked about with other CCLN webinars about some of the updates, but just to remind you that starting in 2021, there have been some updates to the prerequisites and standards, as well as to the pathways. And this is really the first major update to the pathways in quite some time. We'll be moving from 20 to 21 pathways. A few pathways are being retired, and we're bringing on some new pathways. We're very excited about that. We've also greatly simplified the data collection process with the model, with the new visit form and progress form. And I'll talk a little bit after Mark gives you an update on the learning modules and reporting about how we're going to get all this information out to you. So I'll turn it over to Mark right now. Maybe.
Mark, you might be muted.
Well,
can you hear me now?
We can hear you now, Mark.
Can you hear me now?
Yes.
Oh, good.
We can no longer hear you.
Well, I know we're running short on time, so maybe I can just give a quick update. So Mark was just going to talk about the learning modules that go with the learning pathway, which used to be the old education pathway, and we're really excited about that. We're up to 49 learning modules and continuing to develop those, and some of the hubs are piloting those as we speak.
And Mark,
In
I see you're unmuted now.
Yeah.
Okay.
Thank you. Thank you, Amy. Yeah, Sarah, thank you. So good to have you guys all here today. Thank you for taking the time. I'll be very brief. I think Sarah covered it. We've got 49 new learning modules. These come directly from the research that Dr. Hornbeek was referencing. Recent paper in preventive medicine led by Dr. Lynn Folletta that identified all of the modifiable factors of risk by age group, starting in pediatrics, and then we've extended that for adults through PCHI's further work. And so we hope that this curriculum, as part of a care coordination model that's evidence-based, is potentially the most whole person and the most broad that's available. And these modules have been developed by a great representation of scientists, educators, public health leaders, as well as community health workers. And we welcome you to begin to pilot those soon and provide additional feedback and improvements there. And Sarah, did you want me to also mention the benchmark report, or we can skip that for time?
Just briefly.
So the benchmark report is available now on the website, and you can find it under resources, under the resources tab, and then building and certifying hubs. And through this report, we can learn about both our successes and our failures, and make progress towards improving. There are 4 brave hubs that have begun to pilot this, and they include Toledo, Columbus, Akron, and Mansfield, and we thank them and appreciate them for proceeding with this. We are going to be working with them to understand how to best aggregate that data, so that we have available a snapshot of the Pathways Community Hub model as a whole. That project is very separate from the other research projects that are more specific to different grants and other activities that Dr. Hornbeek was referencing, and a very important part of the hub model's development moving forward. If there's any questions or any further interest with that, please feel free to get in touch with me. Sarah, go ahead, please.
Sure. So the next slide, we understand that there's a lot of learning that needs to go along with these updates, and so we're excited, and we've just purchased the Blackboard learning management software, and we're going to be trying out with a new cohort of community health workers. But this is a platform that will really let us give a variety of ways to educate. And we're planning on doing pre-recorded sessions on everything from the prerequisites to the standards, to the pathways, to the data collection forms, you name it. Our plan is to have a training session uploaded for you to go in and watch at your convenience, because we also know you're really busy and it's hard, getting all these time zones coordinated. So if you are interested in being a part of these recorded sessions, Amy and I will be putting together an email shortly after this meeting. So what we really need to know is who from your hub, and that includes their name, their email, and kind of what their role is in the hub, is interested in participating, because we'll actually register you as a student, or as a participant, I guess, not as a student. So be on the lookout for that. And we're always looking for new ideas. If there's a topic that you see we don't have covered and you would really like some more information on, we're very open to that. And we are very interested in getting as much information out to you as possible at this point in time. You'll also be seeing some updates on the website coming up shortly that will show some of these new changes as well. So we're really excited about that. And I will turn it over to Amy.
Thanks, Sarah. The last piece we wanted to discuss about certifications is something you all may have heard about. A new certification that PCHI is providing is for technology platform provider certification. Historically, all of the content needed for the hub was something made available to anyone. And over time, it became apparent that some organizations were taking bits and pieces of the hub model and not having success. I think we all know part of it's what makes it work is the holistic nature of it. So the purpose of the technology platform provider certification is to make sure that the technology providers who we're providing content to are only providing that content to hubs that are on a track, or agencies that are on a track towards certification, and are supporting fully certified hubs. And also these technology platform providers are agreeing to evolve the model with us annually as Mark and Sarah make changes to the model as we learn from research and evidence that comes. So in order to be certified effective in 2021 and beyond, hubs need to be using a certified technology platform provider. There are a number that are being certified right now. We have interest from many of these technology providers, and we'll be providing more information about that as well. We wanted to share a little bit about upcoming webinars. Sarah, do you want to cover them?
Sure. So the next webinar coming up is really around cost benefit analysis, and Mark will be leading that. It will be on October 16th from 1:30 to 2:30 Eastern Standard Time. So hopefully we'll capture everyone's schedule. We will also record that and post that. We also have the CCLN webinar scheduled through next summer. And as I just mentioned, we'll be getting you updates on all of the changes and kind of new and improved Pathways Community Hub model very shortly. That's all I have.
Thank you. And Mark, I'll turn it back to you to bring us home for the last couple of minutes.
By our webinar alone, this is such an amazing time, and we're all having to adapt to so many different situations and different challenges, and yet we're all together and part of the same mission and work, which is just extremely exciting. Consistent with Karen's message at the beginning, we've got to stay together. We've got to learn from each other, and we have to have hope for the future. One of the things that gives us hope and excitement and enthusiasm is Rick, Wilk, and our full team are really looking forward to a time when we can all get together in person with you again. And we're determined to provide a space for you to do that, and to look forward to doing that, to present your work, to present your innovation, and to present the amazing impact that you're having on individuals in the community. And so, although there's so much that's unknown, we think you're going to be hearing from us in the next couple of months and anticipating times in 2021. And if not 2021, then a backup date in 22. But we look forward to being together with you again soon. And thank you so much for being on the call today.
Thank you, Mark.
Great to see everyone.